Hi, my name's Michelle and I do community support work with people who have disabilities. I've done that work since about 1990, and for the last 5 years it's mostly been with people who have visual impairments. At the moment I feel that there are a lot of changes happening, and I'm not sure that all of those changes are going to be for the better. It's quite difficult to be someone who's a key member in a voluntary organisation just now, because although government policy is suggesting that people are going to get much better support and that their needs are going to be understood and that funding is going to be directed and targeted to prevent people getting into crisis or having very serious issues, and that people will be much happier with their support that they're getting. The funding is being cut, basically, and particularly I think for people like myself who try very hard to give a personalised service, who are very in touch and aware with what people actually need and want to do, it's very frustrating. It's very frustrating that, because I see that there's a huge collision really between the government policies and all the things that have been talked about in the press to do with providing better support, including people in the community. Yeah, the collision between that and what actually happens and what actually gets funded and what is seen as a priority by people who have the power to hand out resources. I think there are things that I do with people routinely. There's a certain amount of predictable support and a certain expectation that I will do some tasks. You know, my job description is not prescriptive, so I can respond to crises that people may have or to needs that maybe I think bigger care organisations would have a lot of difficulty doing this kind of work. They wouldn't be flexible enough, and it's kind of worrying that the trend is, on the one hand, personalisation, giving people individual support is being talked about an awful lot, but on the other hand there's a great trend to go towards agencies providing a kind of generic help, and not really working with people in such a specialised and individual way. What I love about my work is that I can be flexible. What is difficult about it is that that flexibility comes with a great personal tag, if you like. I have to make that happen, and I don't necessarily get paid for everything that I do. And there's often quite a bit of an argument about how well that work sits within the framework of some of the organisations that I work for. And increasingly I'm finding that I'm able to respond in situations where previously social services would have responded. So I kind of feel that I'm doing the work of a social worker, but I'm actually working for a voluntary organisation and paid a fairly minimal amount, and don't have the resources and the backup that people in social services would have. And yet people still need help. And, you know, as far as I'm concerned, if I can respond to that, I always will, because that's in my nature, regardless really of the job. And I think there should be more of that kind of response in the work that we do, because it's about the work is about people as a whole, and individual, not bits of people. People's needs and their lives are complex, and I think it's a mistake to try to simplify that too much. I try to take the time to look at people's lives and what they need as a whole, and try also to find other ways of helping them apart from them just maybe relying on me. But increasingly that's becoming very difficult. It's becoming much more difficult because, you know, the resources seem to be disappearing. And yet, you know, we've never had such a good sort of public understanding, if you like, of disability issues, of mental health issues. All of these things are being talked about. The great frustration is that I don't really like what's happening at the moment. I don't like the way that local authorities seem to produce huge documents, you know, about which services they're going to fund and provide, what they're going to cut, and then they have a consultation afterwards. The little people, the little organisations are the heartbeat of the community. They're in touch, and now people working for those organisations are being asked to provide evidence of their work, and they have to jump very high and in lots of different places in order to get their funding. And it's all on the terms of people who have the money. And it shouldn't be like that. It's quite hard for me to talk too much in detail about individual people because I live in a local area, and it would be possible maybe to identify those people if I did that. But I certainly have given support to an elderly person who had a fall, for example, where there were no relatives to step in immediately to support her, and this person would have been taken to hospital otherwise, which the ambulance service didn't want to do because they felt it wouldn't be good for her, and also probably it would be inappropriate as far as accident and emergency services were concerned, and yet she couldn't be left unattended. So I arranged with a neighbour to take care of her during the day, and then I took over the care of her during the night because I was told that she needed 24-hour observation. When I contacted social services, that kind of support was not available, nor was it available through her doctor. So I did it. With social services and people with visual impairments, I think, although there are people still within council services who have an understanding and training in visual impairment, mostly people are, if they're assessed by social services, their visual needs are not understood within that assessment, or they're seen to be in need of very short-term help, and they don't get, for example, not many people get a personalised budget which would allow them to buy support, because their support needs are seen as below the substantial or critical level. So they're on their own. If it were not for the smaller voluntary organisations and people such as myself, and there are, you know, a few people like that in the local area, and networks of volunteers too, who can sometimes step in and help people. I'm just thinking now a little bit about that. I think there's a big assumption with the Care Act that anyone with a disability which significantly affects their life is somehow going to get some money through personalisation, and that they can then buy whatever support they need. But if you're visually impaired, actually the practicalities, even if you qualify, the practicalities of actually organising that and becoming an employer, and sorting out the paperwork involved in that is actually quite difficult. And this may be a little different if you're, for example, a disabled person in a wheelchair, but you have full sight and ability to manage your paperwork. So that's quite a tough situation, assuming the person qualifies in the first place for that kind of help. But one of the organisations I work for had a consultation recently locally, asking visually impaired people what kind of services they actually do want and need. And as it turns out, they want a service which is not going to be easily provided through the personalisation route, such as an advice helpline, a place that they can call up when they have a particular difficulty so that somebody can come in and help them with that. Support to go out and do social and leisure activities, which just isn't funded. It isn't funded. And people with visual impairment are at an incredible disadvantage, particularly if they've been used to operating in a sort of sighted social circle, and then they find they've lost their vision. Well, with losing their vision, sometimes they'll lose their friends, and sometimes people also lose their close relationships too, and particularly that can be a problem for middle-aged people. And the very elderly can often be, you know, completely isolated and sitting at home on their own, which is dreadful. Yes, people were telling us through the consultation that they sometimes have difficulties and they just want to be able to call up and get help. Well, social services aren't able to respond to that. I have a lot of cases in my mind at the moment where people have contacted social services for help and then they haven't got it, so they come to us. But we're not funded to do that kind of work, and somehow people's needs just slip through the net. There may well be people, I'm sure there are people who have got their personalised budget and feel that their needs are understood and are able to find the support that they want and manage it themselves. I think there's a particular issue for people with visual impairment because there is not a good public understanding of what that can mean, and it can mean many things. People can be blind from birth, they can have a degenerative disease and lose their sight later on. They may have a whole variety of issues with daily living, and that won't necessarily be the same for every person. Some people regain their confidence even with very little sight and are able to get out and about and make use of specialised mobility techniques. Some people will never achieve that. They will need a lot more support and help. And I think that the psychological impact of sight loss, together with the impact of the isolation that it can bring, is just something that is not understood. So it is actually quite hard for people with visual impairment to find the support they need. So they're not having it so good, I think. And the disability has a very low profile nationally. As far as local authorities are concerned, they have set particular criteria for help, and that is all based around whether you're able to manage your own personal care, in other words, get to the bathroom and do what you need to do there, whether you're able to put your dinner in the microwave, whether you're able to wash a cup and pour the kettle. Now, a lot of visually impaired people will learn to do all those things or manage those things, but what is forgotten is, what happens when you drop a wine glass in the sink and you can't find the pieces because you can't see. What happens when the meal that you've taken from the fridge is out of date and you don't know because you couldn't see it? How do you ensure that your bathroom is hygienic? How do you find things when you lose them in your home? How do you manage the day-to-day household activities completely by yourself? And there aren't really many people who can do that. But at the same time, they don't sort of meet the threshold for support according to most social care assessments, and therefore they don't get anything. And where the local authority was giving grants to voluntary organisations to provide extra services, now those grants are being cut, and it's just not understood, really. I think it just isn't understood. In my work, and I've tried to encourage people to speak out about what they need and what they want, and in a sense, for visually impaired people, need to become more vocal as well. And we try, through our work, to be vocal with them and on behalf of them if necessary. But it's a very hard job, and it seems very easy for people to ignore. It's a hidden disability. You can't always tell when you meet somebody in the street or in their home what they're able to see. You can't necessarily know their level of difficulty unless you spend time with somebody, to really find out what is hard for them. There are big organisations out there and who are able to present themselves as being able to take care of the problem, whatever that problem may be. And we've seen, similar things happen with things like security services and prisons. And through that, we've also begun to see through those kind of services how things go wrong. We've already had quite a lot of health scandals, but the lessons have not been learned. The scandals in health and social care. Somehow it's thought that producing more regulations and more qualifications and making more and more sort of checklists is going to sort of solve that, but it's not. And I think that that the government needs to be very careful. Local authorities need to be very careful. They won't know what they've got until it's gone. And, if they crush the smaller voluntary organisations who maybe don't work in the way that they set out, who are not able to present themselves in the way that the council wants, they will find themselves with an even bigger problem than they have now.